Hello and welcome everyone to the Smile podcast. This is Dr. Anshul, your smile specialist, and today I'm delighted to announce that we have with us a very special guest, surgical oncologist who has specialized in head and neck cancer surgery, Dr. Shivam Pandya, and he has his own blog by the name of Cuts and Bruises. You can follow him for more by viewing his blogs online. And welcome, Dr. Shivam, to the
Thank you.
podcast
Thank
of
you.
the Smile podcast. You are our first guest, and we are very happy to welcome you. So, how do you feel being a cancer surgeon, first of all?
Being a cancer surgeon, it's a very, very special job in a way because you are dealing with patients who have essentially lost all hope. So patients जब आपके पास आते हैं, most of the time they think that अब उनका life खत्म हो जाएगा, and your job is to restore that hope. So more than cancer surgery, I will say that we are in the work of giving hope.
The emotional balance,
The emotional
mainly.
balance is there. Yes.
Correct. So, what inspired you, first of all, to be a surgeon and then a cancer surgeon?
To be a surgeon, I think I have to go all the way back to my second MBBS. Second MBBS fifth semester, I was attending my clinical rotations, and उस time पे we used to go in the evening sometimes to emergency. So एक बार I just talked to the first year resident and I told him कि sir, I want to assist you sometime. So he called me in an emergency OT. I was a part of a debridement surgery and it was really fun to see. It's a very matlab, if I have to do it now, then I will not enjoy it obviously. But back then, as a young second MBBS kid, I was fascinated by this whole thing that okay, you have a disease, you take out the disease, and the patient is cured.
Correct.
So that inspired me to take up surgery.
Sort of an adrenaline rush when you saw blood.
Yes.
Unlike
yes.
other people.
Surgeons are, people say that surgeons are born, they are not made. And I kind of agree because you need to have that kind of a stomach. And जो हिंदी में जैसे बोलते हैं कि उसका एक जिगर चाहिए उसके लिए. So you need to have that kind of a thing in order to, open up a patient. So even I have written it in my book also that you need to be a borderline psychopath in order to cut open a patient, remove an organ and sew it all back, and tell the patient that you have actually helped him. So you need to have that kind of a mental balance.
And after years of experience, you might have that story, like what changed your outlook towards. There might be one patient के अभी इसको ठीक किया and it changed your outlook completely towards your profession. Do you have any such incident? Maybe?
One thing that comes right off the top of my head was in my third year. I was in Bombay. I was doing my MS in my third year, and there was this one girl who walked in. She was mentally challenged, 18-year-old girl, could not speak properly, and she had a stoma. So her mother came all the way from UP to
Can you
our
explain like
hospital.
stoma to
Yeah,
our
sorry. So
general
stoma is basically when your part of your intestine is kept outside. So because अगर नीचे intestine के नीचे के part में there is some obstruction or there is a cancer or there is any other disease, then you take out a stoma so that the stools, the fecal matter comes out, and then it has to be sutured and put in. तो stoma closure बोलते हैं. So the patient had come to us for a stoma closure, and what happened was they had come all the way from UP. The mother did not have any money on them. Single mother. Husband had left because of the child. The child was mentally challenged, so the husband left the mother. And that day, she came to us, no money whatsoever. I admitted her, and then we did some basic imaging and we found out कि उसके स्टोमा के आगे के इंटेस्टाइन पूरा अंदर से narrowed है काफी. So अगर हम स्टोमा क्लोज करेंगे तो it will again create a problem. So we opened her up, removed the problem, the lesion, and उसके बाद in a second sitting closed the stoma, put it in. I think the entire stay, एक महीना डेढ़ महीना, she was with us. I mean, used to take care very very sincerely because ऐसी लड़की थी, alone mother, alone, doesn't know anything about the city. बॉम्बे में आके बस आ गए हैं. And eventually वो डिस्चार्ज हो गई, and she got discharged, and we made use of a small technicality in the hospital rules and got her entire stay for free. So with the help of my head of unit. So it was the entire thing, like from the top of the unit to the bottom, everybody contributed to that girl going back home.
Wow.
And that was when she went home, the first time I heard her speak something. And it was like a very small and very shy, she said thank you, और वो चली गई. So it was a very told कि ये फील्ड होती है, ये
Correct.
डिफरेंस आप कर सकते हो. You can not just save lives, you can actually give a better life.
Correct. Yeah. So you're not just relieving financial burden. This is like you are doing so much more to that patient
Yes.
emotionally, health wise, and everything.
Yes.
So one of the most noble professions, of course. And after I say that, I also remember like people consider you as God sometimes, and of course you have worked in government setup.
Yeah.
People come with that hope, they give you that responsibility. So
Mm.
how do you take the, do you feel burdened with the responsibility, or do you take up that responsibility very gracefully and do all your job, or have you ever felt burdened at some point?
I'll tell you, when we start off now, everybody thinks that we are God, you know. Sacred games में वो जो डायलॉग है ना कि कभी कभी लगता है कि अपन ही भगवान है. So it happens, everybody, it happens to every doctor, बराबर. But at one point of time ना, the actual God tells you कि भाई तुम इंसान ही हो, भगवान ही भगवान है. That realization comes.
Okay.
And when that realization hits you, it hits very, very hard, because
Oh.
you are suddenly brought down to earth, crashing. Barabar. So what I have experienced that multiple times. I have experienced that in government. I have experienced that in my private work now. And every time, I feel even a little bit ki, okay, I'm in control of things. God says, nahi, you are still not in control of things. And that awareness helps me keep balanced. That I am only doing to the best of my ability. The results, the outcome might not always be in my hand.
True.
And that is what always keeps me grounded, because multiple times I've experienced these things, and अब मुझे लगता है कि नहीं, अभी अपन भगवान नहीं है. So,
And sometimes you feel that इसमें कुछ नहीं हो सकता, and the miracle happens.
Sometimes it does.
Sometimes it does.
Sometimes
Yeah.
it does. Yes.
Maybe that is willpower of our patients. Maybe
Yes.
their faith in God or whatsoever. But
Definitely.
sometimes the miracles also happen, and
Yes.
sometimes you are brought to the ground like.
So, if you have watched this movie Lutera, रणवीर सिंह की आई थी,
रणवीर सिंह, yeah.
2013 I think, 12-13. It is based on this O. Henry short story called The Last Leaf. So that story is all about how hope and belief helps to cure a patient. That was written 1.5 centuries ago, 1900s में लिखी गई थी. But even today it holds true. मैं आज भी patients को बोलता हूँ कि you get operated with me, you get radiation, you get chemo, but don't forget to pray to your God, because eventually उसके हाथ में सब है.
सब कुछ उसके हाथ में है.
So
Correct.
that's how. So that is what I'm saying कि ये जो realization है ना कि भगवान ही भगवान है और हम बस इंसान हैं, हम हमारा काम कर रहे हैं. That bifurcation
Yeah.
helps one keep grounded.
That's how you grow as a doctor basically,
Yes.
and as a surgeon. Of
Exactly.
course.
Exactly.
And सबसे ज़्यादा हमको ये realization मिला था I guess COVID में. Because COVID में you have seen all kinds of patients, and people have also realized what kind of burden these doctors face.
Yeah.
Because at one point, like one patient is going completely onto the ventilator, one is on BiPAP, and
It was crazy.
another patient was getting admitted. Like you don't have that appetite to digest all of this. So how you dealt with that situation?
Back during COVID, I guess I was still in my third year.
Okay.
And
MCH.
yeah. So I was in third year of MCH, and I worked mainly in the non-clinical area. So that was the non-clinical area, means we had to deal with the patient relatives, we had to deal with whatever inquiries that used to come, more of an administrative work.
Okay.
But then that was again, we had to be not in touch with the patient, but with the patient's relatives who had crazy amount of expectations, who were extremely worried.
Sure.
It's very easy to get frustrated at one point, because 60 पेशेंट्स, 80 पेशेंट्स इन द हॉस्पिटल, 80 पेशेंट्स के अगर 5 भी रिलेटिव गिने तो 400 relatives, potentially 400 people might call you in a day. And even if they call just once and they talk for 2 minutes, it's 800 minutes, which is almost 12 hours, more than 12 hours non-stop. So that is the kind of thing. But then again we have to sit down and realize that ये जो patient के relatives हैं, they don't enjoy this. They don't enjoy calling in a hospital and checking कि हमारे patient क्या कर रहा है, क्या नहीं कर रहा है, because they are worried, and it is very very easy to get frustrated. Very easy. It's extremely possible to get frustrated. And even जो लोग wards में who are working, it's the same thing. They were very tired because 12 घंटे का shift PP पहन के. I did that in the second wave. I did the clinical work in the second wave. So we are, I mean, wearing a PP in peak summer, it's very tiring. But at the end of the day, you have to realize कि ये जो patients bed पे हैं, they don't enjoy staying there. And it's our job to make sure whatever their stay is, that stay is good, uneventful, and they go back home. ये एक end point अगर हम दिमाग में रखें, it holds true for everything, not just COVID. Like even if we are talking of our practice, no patient comes to a hospital thinking कि आज मजा आएगा. Nobody thinks that.
Everyone is in a misery when they are
coming. Correct. Our job is to make sure that they go back home with a smile.
Yeah, and that reminds me of there might be some cases, especially in cancer surgery, where you know you will lose a patient or you might have lost a patient. So have you, like, we have to remain detached to our patients. We all know that.
Yeah.
But once in a while that emotional breakdown happens. It happens.
It does.
And how to deal with that then?
I'll tell you something that I learned in the last 4-5 years when I was in GCRA, especially because I was working with cancer. I was dealing with very critical patients on a daily basis for almost 5 years and still doing actually. So there is this philosophy that I have developed. It is called oil on water philosophy. Oil on water means आप अगर कभी पानी में ना तेल डाल के देखो, you try to put some oil in a bottle of water, what will happen? Oil will not mix in the water. Oil will float on top of water. The oil is in contact with water and it is still detached. This attached detachment, what I call, is the oil on water philosophy. And it is what has helped me throughout to remain empathetic to the patient and not yet be attached to the outcome.
True.
In a sense कि जब भी जैसे कि भगवद गीता में भी जैसे कि लिखा है कि you have to do your action, आपको कर्म करना है. Karma doesn't just mean action. It means the sum total of all your actions. Everything you do towards the patient, you have to work. The result will be given by the Almighty, by the God. You don't be attached to the result. Be attached to your action.
Correct.
So this attached detachment is something that I am working on. And yet sometimes there is a turbulence and sometimes the oils and waters do mix. Very recently it happened, I think a couple of weeks back, I lost a patient, very young patient. And we had done a very beautiful surgery. Patient बहुत ही अच्छा. Post-op day 1 collapsed and died. Cannot do anything. I was taking 2 hourly updates from the ward. 5:30 p.m. I got the update. Patient is doing well, sitting upright. 7 p.m. gone. Sudden shock. And for the first time, I think after a very long time, the relatives were crying. I wanted to sit with them and cry because it was so bad. I was so shaken. But then once again, it just happened, and I cannot be attached to the outcome. I have to be attached to my process. 2 days later, I did an exact similar surgery in another patient.
Patients
Went
really
home.
fine.
Went home.
Yeah, with a smile.
With a smile. Yeah.
Oh God.
So that's how
Yeah.
that's how it is. You have to be that, like that oil on water. Attached detachment is the key.
Superb. Yeah. But it's very hard to remain aware of this attached detachment theory,
Yes,
even
it
if you
is.
know it.
Yeah.
Even if Krishna Bhagavan explained this whole thing to Arjun, he still cried on Abhimanyu's death.
It did. It did.
So it happens.
It does happen. The oils and water do mix, and that's why we have mayonnaise.
Yeah, and not just all the serious stuff. हम डॉक्टर्स की लाइफ में मस्ती मजाक भी बहुत होता है. You also have some funny stories with your patient. You also have some incidents that you know just they just crack you up. Some patients are like that. Would you like to share anything
No,
about that?
not exactly like cracking me up or something, but then there were some things that I used to do during my residency, which were actually funny when I sit down and think about it.
Okay.
I used to be someone who was at sometimes ना मैं used to be very much dedicated about one particular patient. अगर कोई patient ऐसा लगे कि नहीं that patient really requires some
Hmm.
special amount of care, and I used to get lot of like very irritable patients at times. I don't know भगवान ऐसे मुझे भेजते थे मेरी परीक्षा के लिए, because I am a very short tempered guy. Used to be very short tempered guy. Lost all my temper in my residency
True.
from this. So there was this one patient I still remember back in my first year uh, of MS, not in MCH, MS, almost 10 years ago now. So एक रैंडम एक रोड साइड पेशेंट थे, पुलिस लेके हमारे पास आए विद डायबिटिक फुट एंड ऑल. उनका मैं ड्रेसिंग कर रहा हूँ, डायबिटीज आ गया, नॉर्मल आ गया, डायबिटीज इज कंट्रोल्ड नाउ, द लेग अल्सर इज स्लोली हीलिंग. तो आई यूज टू एनकरेज द पेशेंट टू वॉक इन द वार्ड, कि आप वॉक करो, आपका थोड़ा थोड़ा मसल्स वेस्ट नहीं होंगे, आपका लिम्ब में स्वेलिंग विल बी लेस.
Correct.
आई यूज टू एनकरेज. तो ऑल माय पेशेंट्स यूज टू वॉक एक्सेप्ट दिस फेलो. So I used to tell them, आप प्लीज आपके कॉट से you walk to the
हाँ.
dressing room so that
सही है.
थोड़ा walk भी हो जाए and I don't have to carry all the material to your cot. तो मेरा भी लाइफ थोड़ा इजी हो जाए. So patient used to be very adamant कि नहीं करेंगे नहीं करेंगे ऐसा. He did not used to eat. वो खाना नहीं खाते थे, मतलब हमारे जो they used to get diabetic diet. So he was like, I don't like this food. So I said कि यार you live in the streets, तुम्हारे आसपास वाले लोगों को खाना नहीं मिलता है, तुम्हें बेड और खाना मिल रहा है, you are getting a good food, you are getting hot food, you are getting a bed, be grateful. But he was like, no, 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 no. You know,
Very
very,
adamant.
very, very adamant. And then what happens is when he would not eat, his sugars would fall. Then he would go into hypoglycemic coma. Happened once. I had to like rush from the middle of my sleep and to revive that person.
Hypoglycemic coma as in कि suddenly
So the sugars
Yeah.
fall below 30-40 and
30,
patient
40.
would collapse.
Yeah, true.
So I had to go and revive him. So
हाँ.
मुझे बहुत ज़्यादा गुस्सा आ गया था उस पे one day. So one day I just went on the rounds and वो food was being served. So I told him कि भाई खाना खा लो. He said no, 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 I will not. Same old story. ऐसे छोटे बच्चे को अपन ने जैसे करते हैं,
हाँ.
same thing. Then I really looked at him threateningly. I was quite huge even back then. So I told him, तुम खाना खाओ, you finish the plate in 10 minutes, or else बस देखना मैं क्या करता हूँ. Just threatened him like this. Finished my round, came back. So last minute खत्म करके खा रहा है.
God.
So आसपास के सब पेशेंट्स हंस रहे हैं, even the staff and all are also laughing कि यार शिवम भाई आप डरा के रखते हो पेशेंट. मैंने बोला यार if I don't do, he will not get cured.
Correct.
Eventually that patient got cured, went home, everything. And until last year I was in contact with him and his relatives. So things like these happen.
Correct. Because patients are afraid of surgeons.
Yes. बहुत.
You just give them one look and they'll be like, okay, I can't ask them क्या उखाड़ लोगे.
नहीं, we can't. But obviously I wouldn't have done anything.
Yeah,
but
of course.
it's just like a little bit of a threat.
Correct.
What we call in
For his
English,
benefit.
it's tough love. That's what we have to show
True,
at times.
so true. So coming back to cancer, there is this old saying, cancer means cancer. People had that, just like you said, they lost all their hope once they came to know that they had cancer. But with advanced technologies, we can cure cancer to an extent that people live life to such a normal extent that they don't even realize that they had a cancer. Is it possible? Is it truly possible?
It is. Actually, what I will say that the treatment of cancer is based on the stage at which the patients come to us.
Correct.
So there are patients, first stage cancer in my OPD, first stage tongue cancer or buccal mucosa, oral cavity cancer. First stage, very early, first or second stage. You look at them, you will not realize that they have been operated. So that happens because they came in a very early stage. We take care to preserve the enough of the normal tissue so that when the reconstruction is done and the
Hmm.
patient goes home, it is as close to normal as possible.
True.
There are patients with a fourth stage cancer, and you will not realize that they have been operated.
Oh,
They
wonderful.
have their mandibles removed. We put a plate, a fibula implant flap with the help of a plastic surgeon. We made sure that we don't cut over the face. So the entire surgery is done from the neck. The
Hmm.
plastic surgery is done. The neck is closed.
True. Yeah.
1 month or 2 months later, you don't realize this patient has been operated.
Hmm.
The patient speaks normally. The patient eats normally, and that is how you take care of the patient intra-op, and the patient rewards you post-operatively. So there are newer techniques in surgery, like there is robotic surgery which is now coming up, and it is giving a very good result for the patient.
That's
In chemotherapy, for example, you have immuno and targeted therapies which have come up,
right. Hmm.
which have less morbidity, less complication, and a very good result. There are newer techniques in radiation which only target the organ affected instead of the previously where the entire field used to be radiated. Now only that organ is
Organ is
radiated,
related. Yeah.
and there is a lesser side effect. So there are newer techniques, newer technologies, newer medicines being developed every single day,
Hmm.
and there are so many cancer survivors in our country that it's not as if कि cancer मतलब कि अब cancel हो गया. That no longer holds true. In even fourth stage we can offer treatment. We might not offer cure in a very advanced stage,
Hmm.
but we can offer a very reasonable and a good quality of life.
Okay.
So as for that, now next part after the surgery, because earlier the whole part was only about survival, whether the patient can live or not.
Hmm.
That's all. So now the newer guidelines or the newer thinking from oncologists is that not only that they're living, but then they
Quality
also
of
have to
life.
live better.
Yeah.
Let's give them a good quality of life.
True.
Why not? Because it's their right. Just because they have cancer, it doesn't mean they have to live miserably.
True.
So the quality of life begins intraoperatively, preoperatively. When you assess the patient, you plan your incisions, you plan the plastic surgery. That's intraoperatively, and then postoperatively, it's the rehabilitation that works.
True.
And for rehabilitation, we actually send to people like you,
Prosthodontist, yeah.
prosthodontist, oncophysiotherapist, physiotherapist. So I think you will be better placed to say ki,
Yeah.
how do you plan rehabilitation.
Yeah, actually, we plan it before surgery only.
Okay.
Because if we plan it before surgery, we get the better results.
Right.
And for that, the social stigma from the patient's mind has to be removed. They shouldn't be like cancer हो गया अब तो मतलब जीने का कोई point नहीं है. First of all, they should be like कि cancer है, let's go early, let's get it detected, let's get it operated. First of all, they have to reach that stage, and they also have to reach to the stage that I have to also chew, I have to also smile in public, I should be able to do that. So for that we are there. Like जैसे आपने बताया, we give implants in fibula, we place implants, we put teeth on the implants. Right. They are able to chew from that side. Earlier पूरा jaw shift हो जाता था, people used to cover their faces. Yes, and socially, yeah, so socially they were so much like in a hood कि नहीं अब
social
हमको
stigma बहुत high.
too much. But अभी वो रहा नहीं. I'm glad that technologies like CAD CAM and pre-planning the surgery via 3D printing is possible. बस अभी ऐसा है कि लोगों को ऐसा हो कि हमको ठीक होना है, हमको खाना है. Right. And we have such patients, we have such stories. Yes. So what would you like to say about that? How does willpower help when they come to you?
Willpower helps a lot, because sometimes you have a patient of first stage who does not make it. I had a patient of first or second stage came to me. No, we took a biopsy. Biopsy came out to be cancer. 1 week, 2 weeks, no follow up. So I called up the patient and relatives and like, क्या हुआ नहीं आ रहे हैं? And the relative told me the patient has died of a heart attack because he thought that there is no way that he will survive.
Oh God.
And he died of the shock. And then there are stage 4 patients who are surviving. for 5 years and more. So it's all a matter of willpower. And another thing, what you said about rehabilitation, I feel it's important that the patient should sit down and demand that.
Hmm.
That demand has to be created. एक बार
Correct.
उनके दिमाग में अगर हो कि नहीं, we not only have to live, we have to live better.
Because it's no longer about adding life to yours. It's
Yes.
about
Making that life
yeah,
better.
making that life better.
It's not about surviving, it's about living, basically.
Yeah.
So you have to give a better life, and
True.
that starts with the patient and the doctor. Patient has to sit down and demand the doctor, I want a better life. What will you do for me?
Post surgery, how will I eat?
Yes.
First question should be that.
Yes.
Because patient survive हो गया, बस उसके बाद malnourishment
सब होता है.
and the emotional ability of not going in public, not speaking well,
Yeah, everything is
nasal
there.
voice, this they completely stop speaking in front of you.
They stop speaking, they stop doing. I mean, पूरा life उनका change हो जाता है. We want that life should be normal. Life should go on as before, and that's why the role of rehabilitation is so strong.
Correct, correct. That's very true. And the last thing I want to ask you is what is that one advice that you will give to your patient, someone who has been diagnosed with cancer or someone who is dealing with cancer currently? What one advice that you would like to give to them?
I'd like to tell that life खत्म नहीं हुआ है. Cancer is a disease like any other disease, and like any other disease, it has a cure. It has many kinds of cures. So हिम्मत नहीं हारना है. Sit down, talk with your doctor, talk with your oncologist, and get the best possible treatment.
That's very true. Because hope is what keeps us all alive.
Yes, exactly.
So, on a closing note, we had this interesting chat with Dr. Shivam Pandya, who has told his not one but many stories. He has delighted us with so many stories, and it was such an insightful discussion. For more discussion, please read his blog Cuts and Bruises and keep smiling like always.